Hi, Mr. Pullman.
Hi.
I'm Jeannie. I'm
Hi,
going to be
Jeannie.
your nurse this morning.
Okay.
What brings you in?
Just for a checkup?
Okay. And are you having any problems?
No, not that I'm aware of.
Okay, excellent. Well, I see that you had some blood work done before you came in, and I appreciate you doing that. I've got your results here. It looks like your blood sugar was 82, which is perfect. Your potassium was 4.0. And your vital signs, your blood pressure was 110/64, and your heart rate was 64, your respiratory rate was 18, your temperature was 37.1, which is 98.6, and your EKG showed a normal sinus rhythm with a heart rate of 64. All very good.
Good.
Thank you.
Oh, thank you.
So, Mr. Pullman, do you exercise?
Yes.
Okay, and what kind of exercise do
Just
you
walk
do?
fast.
Okay, and how much do you walk a week?
About 6 miles a week.
Okay, and do you smoke?
Never.
Okay, are you exposed to secondhand smoke?
No.
Okay, wonderful. Have you had any problems with coughing or colds, anything like that?
Nope.
And are you up to date on your flu vaccination?
Yes.
What about a shingles vaccine? Have
Yes,
you
I
had
had
that?
that. Yep.
Excellent.
Yep.
Okay, you're ahead of the game.
Yep.
All right, well, let's get this exam started, okay?
Sounds
Oh,
good.
I know. The other thing I wanted to review with you, Mr. Pullman.
Okay.
I saw that you take lisinopril, 10 milligrams, and are you having any problems with that?
No, not at all.
No side effects? You haven't noticed a cough with that, anything?
No.
Okay. And you take Zocor for your cholesterol?
Right.
Okay. No side effect, no muscle aches, pains,
No.
anything from that?
Mm-hmm.
And you're taking baby aspirin?
Right.
Okay.
And a multivitamin.
Okay, very good. And I understand you were recently diagnosed with a blood clotting disorder. And you saw Dr. Mueller, the hematologist, correct?
Right. Uh-huh.
And what did he say about this disorder?
Just continue doing what you're doing.
Okay, and taking the baby aspirin.
Right.
And okay, and so you know that if
Not
you have
to worry
any
about it.
right, but if you have a procedure done,
Let
anything
them
like
know.
that, let
Send
the
a chart.
provider know. Okay,
Uh-huh.
great.
Yep.
Okay, so I'm going to start this exam by looking at your head here, and I noticed some scars up here. Is this from skin cancer surgery?
No.
What is this from?
Just from hitting my head around the house.
Okay, bumping your head.
Bumping
You
my
just
head.
need to be a little more careful with that, I guess.
You have to blame my wife.
Oh, okay. Yeah, she's terrible.
She is.
Okay. And then I'm going to look at your ears here, Mr. Pullman, and do you have any hearing loss that you've noticed?
No.
You're not having to say what, or people aren't having to repeat themselves to you? Okay. Any drainage from your ears?
No.
Any pain?
Only when you squeeze them.
Okay. And I'm going to check your sinuses. Any pressure here?
No.
This is your frontal, and any sinus pressure here.
No.
Do you have a history of sinus infections?
Yes, I had.
Okay, none recently though?
No, I've had an operation a few years back and worked out great.
Okay, great. Okay, and so now I want you to look in my eyes, and I'm going to pull down here, and your conjunctiva or pink. Any problems with dry eyes?
No.
Okay, and why is this pupil dilated?
I got hit with a tennis ball a few years back.
Okay, all right. And look at me, and I see your pupils, other than that, being unequal. Can you follow my finger without moving your head, please? Okay. Your nose, do you have any problems with stuffy or runny nose?
No.
Do you have seasonal allergies? Any environmental allergies?
No.
Okay, I'm just gonna, if you could tilt your head back for me. Just gonna look up here. I don't have, okay, very good. And then I'm gonna check here. Can you open and close your mouth? Any problems with your jaw being stiff or sore? Can you open your mouth for me and say ah? Okay. Any problems with sore throats?
No.
Okay, you see a dentist regularly? No
Right.
problems chewing, swallowing?
No.
Okay, very good. All right. And now, can you tell me your name?
Gordon Pullman,
And what's today's date?
July 21st, 2016.
Okay, and where are you?
9831 Paisley Lane,
Okay, all right. And who's the President of the United States?
Obama.
Okay, all right. So now I want to look at your hands. Mr. Pullman, do you have any problems with your fingers or your joints being red or swollen?
No.
Okay, is there a family history of osteoarthritis or rheumatoid arthritis?
No.
Okay, and I'm just going to look here. Do your fingers get cold or blue
No.
become painful, anything like that?
No.
Okay, and let me see this here. Okay, no tender joints, nothing
No.
like that.
No.
Great. Can you go like this for me? Okay, and can you put your hands together? I'm going to try and pull them apart, and you work as hard as you can without clasping your fingers to keep them together. Okay, excellent. Look out. And can you squeeze my hand? Okay, very good. All right. Now, let me see your elbows. Okay. Okay. And your shoulders. Any shoulder pain difficulties?
Mm-mm.
Okay.
No.
And they appear symmetrical as well. So can you do this for me? Flexion and extension. Other side. And then adduction, abduction, adduction, abduction. Excellent. Any problems doing that? Any
No.
pain? Okay. Can you stand up for me? All right. Your hips are... Any problem with your hips?
No.
Is there any history of joint replacement surgery? Anything like that in your
No.
family?
No.
Really? Not even your father? Okay. All right. So can you bend over straight? Any pain?
No.
Okay. And can you do this? Bend over again for me. I'm just going to check your spine. Okay. Great. Can you put your head to your neck? To your chest, rather?
Mm-hmm. Yes.
Can you tilt it back?
Yeah.
Okay. And then side to side. Any pain there?
No.
Okay. All right. Have a seat for me again, please. Okay. And then I'm going to look at your knees. Okay. Can you take your hands off your knees, please? Okay. So I'm going to press your knees together. You try as hard as you can to press them apart. Okay. All right. Very good. Okay. And can you lift your feet here? And press down. Okay. And again, dorsal and plantar flexion. Any problems with your ankles swelling?
No.
Okay. Any problems with your toes becoming numb or tingly? Anything like that?
No.
Okay. All right. Can you go ahead and lay down for me, please? Okay. So I'm going to palpate your liver and your spleen. Any pain? Tenderness? Am I boring you?
No.
Okay. All right. And I'm palpating your abdomen. Any pain?
No.
Okay. And I'm going to listen to your bowel sounds. Okay, your bowel sounds are positive in all quadrants. They're normoactive. Okay, if you'd sit up for me, please. I'm going to listen to your lungs and your heart. Any problems with chest pain?
No.
Okay. First, your heart. I'm going to listen with the bell. Okay, and I hear S1 and S2.
Okay.
And I'm going to listen to your lung sounds, okay? Deep breath in for me. And blow it out. And again. And again. Okay. And again. And again. And again. Okay, this time I'm going to listen to your chest and I want you to say the word 99. You say 99?
99.
99?
99. 99. 99.
Okay, thank you. All right. Okay, and I'm going to palpate your arteries here. It's warm in here. Okay. Okay, and then if you could go like this, tibial arteries, popliteal arteries. Okay, and then if you would just lay back for me one more time, please. Okay, and I'm going to palpate pedal pulses. Bounding pedal pulse. Bounding pedal pulse. Okay, and I'm going to palpate femoral artery. Okay, and I'm going to listen to abdominal and abdominal arteries. And I hear no bruits. One more thing I forgot to do. Can you sit forward for me, Mr. Pullman? I see no JVD, and I'm going to listen for bruits. And I do not hear any bruits. Okay. Any history of stroke in your family?
No.
Okay. And I think that about covers it. Any questions for me?
Not that I'm aware of. No, very
Okay,
good.
so Mr. Pullman, what I would recommend is that you continue with your blood pressure medicine. Do you keep a record of your blood pressure? Do you check it at home?
I do.
Okay, so I would
I do.
recommend that you maybe keep a diary for the next time that you come in
Okay.
for your blood pressure medicine refill, and we can take a look at that. We might be able to cut it in half
Right.
because you're doing so well.
Exactly. Right.
I would recommend that you continue with your aspirin. One big thing I would recommend is that you wear a hat to avoid bumping your head so much. And I also noticed that you have quite a tan. I would definitely recommend wearing sunblock when you're outside.
Right. I generally wear my shirt.
Okay, but still your neck, your arms,
Right.
and your head look very tan. So we want you to continue with that. Okay? Any questions that I can answer?
Not that.
Okay,
No,
thank you
good.
very much, Mr.
Thank you.
Pullman. Thank you for cooperating.
Thank you. Have a good day.
Thank you.
All right. We'll see you.
Okay, so I found that Mr. Pullman's vital signs were all within normal limits. He actually had a really good exam. He takes good care of himself. His heart sounds were normal. They were regular rate and rhythm without gallops or murmurs. There were no jugular venous distension, no bruits, no carotid bruits. His head, eyes, nose, and throat exam were normal with the exception of his left pupil, which is dilated from an accident. I saw no drainage in his nose. His oral mucosa was pink without any drainage. He has good dentition. His neck and shoulders were symmetrical. I did not notice any scars or lesions. And he denies shoulder pain. He had good range of motion with abduction and adduction with shoulders, arms, elbows, hands, wrist, and fingers. His abdomen was soft and non-tender with positive bowel sounds, all quadrants. Arteries were palpated, no bruits heard. Liver and spleen were palpated but within normal limits. And his feet and ankles, there was no swelling, and he denies any cyanosis of fingers or toes, and I did not see any clubbing. The patient denies smoking. He denies exposure to secondhand smoke. There is a family history of hypertension and heart disease. And I would just recommend that he keeps doing what he's doing because he seems to be taking really good care of himself. And I think I am done. Thank you very much.